Okay, also I'd like to start off by asking you a really important question. Do you consent for me to be videotaped while I examine you?
Yes.
You consent?
Yes, I consent.
Okay, all right, let's go ahead and get started. I'm just gonna start off by just inspecting your eyes, your head, your nose, all this stuff, and as I go through, I'll let you know what I'm doing. If you have any questions, make sure you let me know, okay?
Okay, I will.
All right, so I'm looking at your head, your skull to see if there's any abrasions, lesions, any abnormalities in your neck and in your head. Looking this way too. Okay. All right. Now look at you. And in your face, I'm looking for any scars, rashes, or any abnormalities. I don't see anything. Your pupils look equal, and your sclera looks white. Okay. All right, now I'm going to go ahead and look into your ears. Okay, I'm going to pull your ear up and back and take a look. Okay, the external canal doesn't have any drainage, any abnormalities of any kind. Okay. All right, the cone of light is 5 o'clock. The tympanic membrane is pearly gray. And as I'm looking around, there's this pink malleus, umbo, everything looks fine. There's no drainage or any wax or anything at all. Looks normal. Okay, I'll go to the other side. Okay, pull up and back. Okay, the external canal looks good. No abnormalities, no drainage. Okay, the tympanic membrane is pearly gray. The cone of light is at 7 o'clock. No abnormalities noted. Okay. Okay. All right, I'm going to go ahead and do an examination. Just tell me if you feel any tenderness. I'm palpating the terragus and the pinna. Okay. All right, now I'm checking the skull for any depressions, lesions. Is there any tenderness?
No.
Okay. The texture of the hair looks the same throughout. Okay. All right, tell me if you feel any tenderness. I'm checking the frontal sinuses. Any tenderness there?
No.
Okay, the maxillary sinuses, I'm checking for tenderness here. No?
No.
Okay. All right, now I'd like to go ahead and check your lymph nodes. This is the preocular lymph node area. And again, let me know if you feel any tenderness. And then the postocular lymph node area, no. Okay, then tonsillar, submandibular lymph nodes, submental, and then we're going to go anterior cervical lymph nodes, posterior cervical, occipital. Okay, I'm just going to reach for the supra, then clavicular lymph nodes. Okay. Okay, now I'm going to check your temporal pulse. No thrill felt. Pulse is 2+. Your carotid, do one at a time. 2+, no thrill felt. 2+, no thrill felt. Okay, now I'm going to check cranial nerve number 11. I want you to raise your shoulders up as I give you resistance. Good. And then back down. And then one more time up. Okay, now I'm going to check again the same cranial nerve 11, the spinal accessory, you're gonna turn your head toward my hand. Okay, good. Turn your head toward my hand, good. Now, we're gonna also check cranial nerve 9, the hypoglossal. I want you to push against, with your tongue inside your mouth, push against that cheek, good. Push against that cheek, good. Okay? All right, let me think about what I'm gonna do next. Okay? So I checked everything. I checked the lymph nodes. Okay, now I'm gonna check your trachea. I want you to swallow. I'm looking for the trachea to see if it's aligned. This is the cricoid cartilage. Okay, good. All right, now I'm gonna go around and feel the thyroid. Okay. Cricoid cartilage. Okay, I want you to swallow. The isthmus was palpated and felt, everything, no nodules noted. Okay. I'm going to inspect your mouth. Let me see if this light is the light that I want to use. See how it looks. Okay, I think this might work. Okay, all right, go ahead and open your mouth. The mucosa is pink. I don't see any fillings unless they're white. The teeth look, they're all in place. Okay, can you stick out your tongue? Okay, the papilla looks normal. Okay, and now I'm gonna get a tongue depressor so I can look way back. Okay, I want you to say ah. Okay, the uvula is slightly deviated toward the left when he says ah. And one more time, I'm gonna just try to look back there. Sorry. The pharyngeal tissue back there looks pink, kind of red. Okay. Oh, and now I want to check the gingiva. So, I'm going to use this tongue I can use this tongue depressor to move your tongue, sorry. Okay, so all right, so hold your tongue out. I'm just going to move it so I can see underneath the submandibular salivary glands. Go this way. Okay, everything looks good there. No abnormalities. No lesions, nothing like that. The lips look also okay. Everything in the mouth was moist and intact. Okay, I'm gonna go ahead and I'm gonna do some eye assessments. I'm gonna start off by checking your peripheral vision. So I'm gonna have you cover your right eye. And I'm gonna ask you when you see my fingers to say now.
No.
Okay.
No.
Okay.
No.
Okay, now I'd like you to switch eyes. Okay, start again.
No. No. No.
Okay, all right. Let me think. I want to go ahead and use something here. I'm going to have you look at my finger. I'm checking cranial nerve number 3, 4, and 6. 3 is ocular motor, 4 is trochlear, and number 6 is abducens. So I'm going to start here, come down here to the middle, and then down, back to the middle here, up, down, all the way down. Okay, so the inner downward view of your eye is the cranial nerve number 4. When you look laterally, it's cranial nerve number 6. Now I'm going to check convergence. I want you to keep looking at this pen light, even if it gets as close as it can to you, just keep looking at it. Good, okay. Now I'm going to ask you to look at the distance, and now look at the pen light. Okay, look in the distance, and then at the pen light. Okay, your eyes accommodated, your pupils accommodated the difference in the distances. When I had you look at this all the way in, your eyes were able to focus and form one object. Okay, oh, now I'm gonna check your pupillary response. Again, you're gonna look at the distance. Try to keep your eyes open for just a sec. Direct pupil reflex. I'm looking at the left eye as consensual reflex. Open your eyes wider. Okay, now the other side. Direct. Consensual on the other eye. Okay, good. Sorry about that. All right, now I'm gonna check your nose a little bit more. I want you to close your eyes. I'm gonna have you smell an object and let me know if you can smell it and what it is.
Okay.
Close one side of your nose. Okay, tell me what you smell.
Strawberry.
Okay, switch sides. Okay.
Same strawberry.
Okay, now we'll do the same thing, only this time I'm gonna focus on your airflow. You can open your eyes, just do one side where you can breathe in through your nose and then out through your nose on one side so we can see if the air flows freely. Good. Good, okay, all right, let's see. All right, let's go ahead and do some hearing tests. I'm gonna activate this tuning fork. I'm gonna put it right here. We're gonna check lateralization to see if you can hear equally in both ears or one side over the other, okay? So just let me know. Did you feel the vibrations in both ears or one ear over the other?
I'd say both the same.
Okay, good. This is the Weber test. Now we're gonna do the running test. I'm gonna activate this, go under your ear. When you stop feeling the vibration, say now, and then I'll put it against your ear, not, touching, but near your ear. And then when you stop hearing it there, then you'll say now. So it's kind of a twofold test.
Okay. Now. Now.
Okay, good. Your hearing is very good. All right, let's go this side.
Now. Now.
Good. Okay. Okay, we're going to do the whisper test. I'm going to have you close your right ear with your left hand, occlude it, and I'm going to whisper something and just repeat what you hear, okay?
1, 2, 3.
Good. Okay, I'll go this way. Occlude the other ear. Good.
A, B, C.
Okay, good. All right, now I'm going to look in your eye with the endoscope to see your retina. This one's going to be a little annoying but not painful. Okay, actually I'll have you look like maybe up in the corner. So you can keep your eye open. Okay, I see the red reflex. I see the retina, the blood vessels, and the disc. Okay. Other eye. Go this way. Left eye to left eye. It'd be better when the light is, if the light is dim, it's better for this test. I see the red reflex. Okay, I see the retina, the vessels, the optic disc. There doesn't seem to be any abnormalities. Okay, we're gonna do another eye exam. I'm gonna use this chart, Snellen chart for you to look at. It's kind of like the doctor's office, only smaller. I'm gonna hold it 6 feet out. I want you to cover one eye. So pick one eye. So you're gonna use your right eye first, so I want you to read from the top as low as you can.
So start from the top.
Yes.
E, L, T, F, P, H, O, L, C, F, D, H, J, B, S, E, P, T, Z, O, C, F, D, H, J, L, T, F, P, H.
Okay, 20/20 on that eye. Okay, now I don't have to move. Okay, switch eyes and start again.
E, L, T, F, P, H, O, L, C, F, D, H, J, B, S, E, P, T, Z, O, CFDHJ, LTFPH.
Okay, now we're gonna do both eyes. So since you're here, since your eyesight is so well, instead of starting all the way to the top, go ahead and start on the fourth line.
Okay. DHJBS, EPTZO, CFDHJ, LTFPH.
Perfect, 20/20, good for you. Okay, so let me just kind of gather my thoughts. I'd like to look at your nose.
Okay.
So this is gonna change my instruments. Okay. Now I'm gonna try not to go very far because obviously I have a light, but obviously if something hurts, let me know. Okay, so I'm just gonna gently hold this up here. I'm looking at the septum, the turbinates, the mucosa. It looks a little pinkish red, the turbinates do. There's no drainage that I can see. Okay, now I'm gonna go to the other side. Okay, same thing, the turbinate looks the same, kind of pink and red. You can see the blood vessels. There's no drainage, there's no irritations that I can see in your skin. Okay. All right. I believe this is the end of the test. Thank you so much for participating.
Thank you.